Hey guys, today we are talking about atrial fibrillation. Now for a quick overview, atrial fibrillation is where we have multiple disorganized cells producing additional electrical impulses in the atria. So this is going to cause the atria to quiver at a fast rate, greater than 300 BPMs. The heart is unable to effectively contract, which causes pooling of blood in the atria and a high risk for stroke. We also see the AV node blocks some of the electrical impulses from reaching the ventricles, rapid irregular ventricular contractions. Now, in general, we are going to see these specific characteristics of atrial fibrillation. First, we're going to see an irregular rhythm. Second, our rate, the atrial rate, is going to be greater than 300 BPMs, wavy baseline. Ventricular rate, 60 to 100 BPMs, greater than 100 BPMs is rapid ventricular rate, or RVR. Our P to QRS ratio, we're going to see no obvious P waves, a wavy baseline that is not measurable, a PR interval that is not measurable, and the QRS complex is going to be between 0.06 and 0.12 seconds. So those are our general characteristics of AFib. Now let's talk a little bit about our assessment. So firstly, let's talk about what the client presentation is going to look like. We're going to see palpitations, fatigue, lightheadedness, and syncope. Now let's look at acute versus chronic. If acute, it'll convert to a normal sinus rhythm. However, if chronic, we're going to monitor the rate, we're going to monitor meds. Atrial and ventricular rates. We're going to look for that RVR, that rapid ventricular rate. Decreased cardiac output, syncope, hypotension. And we're going to check PTINR if the patient is taking Coumadin. Now, therapeutic management for AFib. First, our nursing interventions, depending on if it's acute or chronic, we're going to look at that. There's going to be a 12-lead EKG. We're going to restore normal sinus rhythm, and we're going to assess for signs and symptoms of a stroke, which we mentioned earlier. Second, we're going to control the ventricular rate with medications like antiarrhythmics, beta blockers, calcium channel blockers. Second, transesophageal echocardiography cardioversion. And third, ablations. Lastly, we're going to look at decreasing the risk for stroke using anticoagulants, possibly Coumadin, Xarelto, or Eliquis. Okay, again, we were talking today about atrial fibrillation, which is multiple disorganized cells producing additional electrical impulses in the atria. Thank you so much, guys. Happy nursing. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's NCLEXbook, NCLEXBOOK.com. Happy nursing.